Lisa Ng. I'm an OBGYN and I've been here with Acacia OBGYN in the medical center at St. Luke's Baptist Hospital for the last 7 years. So in terms of preparing for labor, there are a lot of great resources out there. The What to Expect book is a really good resource for patients. St. Luke's, the labor and delivery website has a lot of free classes and a tour of labor and delivery that's also really helpful. There are birthing classes and breastfeeding classes, all of which are really good. I do tell patients wait until you're about 32 weeks along or later, mostly because it's a lot of information. You can easily forget a lot of it. In terms of diet, I tell people throughout the pregnancy just eat small meals frequently throughout the day, so don't let it go too long between meals, but you also don't want to eat too much because then if you have heartburn or nausea, you can actually feel a little bit worse. So just small, frequent meals throughout the day, and pretty much anything that's healthy-ish that you're craving is good for you. Okay. In terms of exercise, the big thing I tell patients is whatever you feel like you can tolerate. Don't push yourself too much, but I also think moving around, stretching also helps with a lot of the aches and pains of pregnancy. The big thing for exercise is, check with your doctor first, make sure it's okay, and don't try anything that you've never tried before. If you've never run a marathon before, now is not the time to train for one. But usually exercise is a very good thing. It helps with aches, pains, and it gets the blood flow going to the baby. So, personally, I think the birthing class is really helpful, just so you get an idea of kind of the flow of labor and delivery and how things go. Breastfeeding class is good, but I found, especially from breastfeeding my own kids, is that it's a lot of on-the-job training, and we have great lactation consultants at St. Luke's that will help you when the baby gets here, just working with positioning and trying different things, to get your baby to latch on well. But sometimes people like having the class beforehand just to see kind of how all things go. But we're here to help you after you deliver to kind of help with getting baby to latch on. So in terms of pain relief during labor, you have plenty of options. Kind of like I mentioned before, moving around does help. Maybe it helps distract you, but it also kind of helps get the blood flowing and does help with pain. Positioning, usually kind of maybe leaning over something does help get the baby's weight off your back. That helps a lot with pain. You can take a hot shower, not too hot because we don't want you to feel lightheaded, but you can take a warm shower. We do have a tub that we do have available if you'd like, and all you have to do is just ask for it beforehand. So hydrotherapy does help for labor. I don't recommend delivering in the tub, but sometimes the water does help a lot with the aches and pains of early labor. In terms of medicine options, you can have IV pain medications as long as the baby looks okay and as long as you're doing okay. That can last for about 2 hours. It can take the edge off the pain for a little bit. I don't recommend getting IV pain medicine after about 8 centimeters, just because sometimes the pain medicine can make you very sleepy, makes the baby very sleepy, and we want you guys both awake and alert at the time of delivery. Epidural, it's one of the most common, most popular options for a good reason. It's not the only option, but it is one of the more effective ways of kind of managing pain during labor. You can get it whenever you want. It doesn't slow down labor, it doesn't hurt the baby, but it does limit your ability to move around. Moving around does help bring the baby down, helps you get into labor. So usually for an epidural, I usually lean on the nurses. If the nurses tell you, what, I think it may be time for an epidural, I think it's a great time to think about one. a birth plan is actually kind of a fun little exercise you can do, and it kind of does help with you thinking about what you do and don't want during the labor process. The only thing is there are a few things that are, either kind of standard or non-negotiable. The big things with a birth plan, are, do you want your baby to be monitored or not monitored? Do you want an IV or not IV or no IV? Positioning during labor, delivery positions, things like that. The only thing for us here, I think, that are a little bit non-negotiable are fetal monitoring. If you have a completely low risk, uncomplicated pregnancy, then we can talk about monitoring options. An IV is something that's a little non-negotiable just because it's always helpful to have an IV in place when you're in the hospital, just in case something happens. You like to have that in place sooner rather than later. With positioning, I think all of us agree you can labor or deliver in any position that feels comfortable to you. The big limiting factor for that is, pain control is what position can we get you in where you're most comfortable. And if you have an epidural in place, how can we kind of get you comfortable and deliver safely? So those are maybe the big things for a birth plan. I think it's a great kind of thing you can do with your partner is to fill out a birth plan, but it's not required at all. Packing the bag for labor, I usually tell my patients enough kind of loose, baggy, warm clothing to last you about 3 or 4 days. We don't know how long else you're going to stay in the hospital, but especially postpartum, I think mommies want to wear clothes that are more comfortable for them, partners included. And again, lots of warm options just because it can get cold in the hospital. I do say, don't bring diapers, wipes, anything like that, because we'll give you all of that in labor and delivery. You need to bring pacifiers, formula, nothing will bring that to you. But I do recommend bringing yourself snacks and then something to do, just because there's a lot of downtime on labor, and especially after you deliver, you might want to need a snack of your own or something to do in case you get so again, I'm Dr. Lisa Ng. I'm one of the OBGYNs here at Acacia OBGYN in the medical center, and we work out of St. Luke's Baptist Hospital, and we are accepting new patients. So if you ever get a positive pregnancy test, just stop on by.